Hello, everyone, and welcome to another stop along the 2020 Mount Nittany Health virtual tour. Today, we are here with Pete Roy, MD, Mount Nittany Physician Group Neurology. He's joining us live from the Sieg Neuroscience Center in State College. Welcome, Dr. Roy. It's great to have you.
Welcome. Thanks for having me, Leanne. It's great to be here on Facebook Live.
Great to see you. Dr. Roy, let's start by introducing you. Tell us a little bit more about yourself and what you do here at Mount Nittany Health.
Well, I've been practicing neurology since 1988. I'm a general neurologist. A neurologist sees conditions of the brain, spinal cord, nerves, and muscles. And we'll see a wide variety of neurologic conditions here.
Okay, very good.
Sclerosis, movement disorders such as Parkinson's disease, and also concussion. But I'll see just about anything neurologic.
Okay, great. Can you tell us a little bit more about some of the services that are provided in the space we're visiting today?
Sure. Well, here at the Sieg Neuroscience Center, we see outpatients. We will see patients live in the office. We have a team of neurologists, and we'll either see you live in the office, or we can do telehealth visits, which could be a two-way audio-video visit, or we could simply do a telephone visit if that's what it came to.
Okay, great.
Now, the other thing is we'll see patients at Mount Nittany Medical Center, and we'll see inpatients there. And at the hospital, we'll see a large variety of patients, but particularly stroke. And stroke, I think, is what we really want to emphasize today and talk a little bit more about that.
Great.
At Mount Nittany Medical Center, we're a Joint Commission certified primary stroke center, and we've won numerous awards over the years for our quality care of patients. So we're pretty proud of that.
Mm-hmm. Very good. For our live viewers today, if you have a question for Dr. Roy regarding stroke care, prevention, or treatment, simply type it in the comment section below, and we'll do our best to get through those today during our short time together this afternoon. Dr. Roy, let's start with this question. What exactly is a stroke and how does it happen?
Well, a stroke occurs when a portion of the brain is deprived of blood or oxygen and other nutrients, and that area of brain will suffer because of that, and you'll get certain symptoms depending on where that area of the brain is.
Mm-hmm. Yeah. So there are two types of stroke that you mentioned. Can you talk to us about each of those?
Well, one kind of stroke is what we call ischemic or thrombotic. If a blood vessel closes off, that little area of brain is deprived of blood or oxygen, and then you can have problems. Another way is if a blood clot breaks off, say from the heart or a big vessel in your chest, and that could go upstream and lodge, and that could cause a stroke.
Mm-hmm.
Another way is if a blood pressure ruptures, and that would be a hemorrhagic stroke.
Mm-hmm. So either way, blood flow and therefore oxygen is not getting to the brain, which causes parts of the brain to not function or those cells to die. So the faster you get that blood flowing, the quicker you can save a life.
Yeah, I agree. And that's why it's so important to know the warning signs of a stroke and to get to the hospital as soon as possible to see if we can save as much brain as we can, because the sooner you come, the sooner we can do things to help you and restore you back to the way you were.
Okay, great. Let's talk for a moment about the signs of a stroke. When it comes to learning the signs of a stroke, what are some of the signs that our viewers should know?
Well, I think one way to learn about the stroke warning signs and symptoms would be to learn the acronym BEFAST, B-E-F-A-S-T. And each letter stands for something important about stroke. So B would be for balance, if suddenly your balance was off or you weren't coordinated. E is for eyes. Perhaps you had the sudden onset of blurry or double vision or lost vision in an eye. F would be for face. Perhaps you'd have numbness or weakness on one side of your face suddenly. A is for arm, but it could include your arm or leg. Think of a limb, one side of your body suddenly becoming numb or weak. S is for speech. So you could have slurred speech or suddenly you couldn't get words out. And finally, T is for time, to remind you time is of the essence get to the hospital as soon as possible. You know, a lot of people think, ooh, I'm having maybe a stroke. I'm having some of these warning signs. I'm going to drive myself or get my loved one to drive me to the hospital. That's really not a good idea. Even though you think, boy, I'll get there faster if I drive, compared to me calling an ambulance, having the ambulance come, and then taking me to the hospital. But the problem is things can happen very suddenly on your way. If you were driving to the hospital and something suddenly got worse, you couldn't do anything about it. It's actually far safer to call 911 if you think you're having a stroke, get the ambulance ride to the hospital, and we'll be able to treat you very, very quickly that way.
Okay, great. Thanks, Dr. Roy. Very helpful. Recently, an article was published about Mount Nittany Health's award-winning stroke program, which you already mentioned in today's broadcast. I'm wondering if you can tell us a little bit more about how that stroke program works and how is it coordinated?
Well, if a patient feels they're having signs or symptoms of a stroke and they call 911, already in the ambulance ride over, the ambulance crew is communicating with the emergency room doctors, and they're already starting to do things for the patient right during that ambulance ride, so that when they arrive to the hospital, they go immediately to treatment, and they're immediately being seen by healthcare professionals, getting evaluated, getting a CAT scan right away, and determining based on the time frame of when they have their symptoms, whether they can get the clot-busting drug, TPA, or what other treatment we can do to help maybe reverse or treat their stroke. So a lot of things happen in the emergency room very quickly. Now I'm going to back up. If you drive yourself to the hospital, that pre-notification isn't there, so we can't immediately jump on things like we can when you come in by ambulance. It's much, much better to go by ambulance. And once you're in, we can treat you. Now, while you're in the emergency room, we also have 24-hour access every day of the year to stroke experts from Hershey Medical Center. It's a telehealth stroke program, and they'll communicate with our ER doctors, and they'll communicate with you right in the emergency room exam table. You'll see them on the video screen. And then our emergency room doctors and the telestroke doctors will make decisions in your best interest to get you as good as you can be, as soon as you can be. Sometimes we treat with medicine, sometimes we don't. Sometimes we have to transfer you to another facility if you require some specialized treatment that we can't do at Mount Nittany. But most of the time, we'll take care of you here at Mount Nittany, and the neurology team will see you and add to your care also. Okay. There's a lot of quality measures that we do to help take care of you throughout your entire stay.
Okay. Very good. Along those lines, Mount Nittany Medical Center is recognized as a primary stroke care center. I'm wondering if you can explain a little bit more about what that recognition means exactly.
Well, there's two kinds of recognition by the Joint Commission for a hospital like ours. One would be a primary stroke center. One would be emergency room only. There are a couple of hospitals in the central Pennsylvania area who are emergency room certified stroke. A person would come to their emergency room, they would triage them and treat them and ship them off to a primary stroke center, or maybe a comprehensive stroke center like Danville, Geisinger Medical Center, or Hershey Medical Center in Hershey. But a primary stroke center, we can handle most anything with strokes, and we go through a long process of credentialing and education to get to this point. We've been primary stroke certified since 2014, and I think we've done a very good job. We have an excellent stroke coordinator. She does a great job at making sure all the systems coordinate in our hospital.
Mm-hmm. Very good. Along those lines, are there any other awards that the stroke program has received?
Well, the awards tend to be for the quality of care we give. For example, are we getting to people fast enough? National guidelines have been traditionally that we want to get to a person within 60 minutes of the onset of their stroke, giving them a drug called TPA, or their clot-busting drug, as it's called.
Mhm.
We get up to 3 hours to do it, but we like to do it within that hour. More recently, the Joint Commission and the national guidelines have established that it's much better if we can get to people within 45 minutes. And we've been able to do that in a large percentage of our patients. So we get recognition for that.
Mhm. Great. So again, as Dr. Roy mentioned, in the event of the stroke, the saying time loss is brain loss means that the faster you treat a stroke, the less likely permanent brain damage will occur for the patient, which is why it is so important, if you experience any of the symptoms that Dr. Roy had mentioned previously, to call 911 and we can make a plan for you at the medical center. Great. At this point, we will turn to viewer questions. We'll start with questions we received ahead of today's live broadcast. However, for our viewers, if you have a question for Dr. Roy regarding anything related to strokes, please go ahead and type it in the comment section below, and we'll do our best to get through those today. So Dr. Roy, starting with a set of questions we received ahead of today's broadcast, the first question is this. What do you do, and you touched on this recently, what do you do if you think you are having a stroke? Is it safe to drive yourself to the hospital? What about a loved one?
Well, again, as we've said before, you have to know the warning signs. If you feel that you might be having a stroke, or maybe you're not sure, but that's okay. Call 911 and get to the hospital. Don't think you're going to be doing yourself a favor by driving yourself or having your loved one drive you there because you feel you'll get there faster than an ambulance. Too many things bad can happen, and it's much better to call 911 and be transported safely by the ambulance crew.
Okay, very good. The next question is this. What is the most common sign of a stroke that you see in your practice? Is there a most common sign?
Well, we see a large variety of stroke signs because any area of the brain could be involved, and that could lead to a wide variety of symptoms. However, I think speech problems like slurred speech or trouble getting words out, or weakness or numbness on one side of the body, they tend to be the most common. Sometimes they come on and they stay. Sometimes they come and they go after 10, 20, 30 minutes. That's still a warning sign. Even if it's temporary like that, you still should go and get checked out because it could mean something else worse is going to happen later.
Right. And when you mentioned numbness on one side of the body, could that be limited to just a small portion of the body, like a face, or is it the entire right or left side of the body that, in your experience, that you see as an indicative of a stroke?
Well, that's a great question. Sometimes it can be small parts of the body, and that can be confusing and difficult even for physicians in the beginning to see if this is a stroke or not. But most of the time, it's going to be the whole side of the face or the lower half of the face, or the whole arm, or most of the arm, most of the leg if it's two limbs.
Mm-hmm.
It's not going to be both sides, though. That's a different kind of phenomenon.
That could be something else.
Could be.
Okay. Our next question is this. Are there any foods or special diets that can prevent strokes from occurring?
That's an interesting question. There's no food that causes stroke or prevents stroke specifically. However, there are a lot of risk factors for stroke, which I think is very important to know about. For example, if you're a cigarette smoker, you're going to be at risk for stroke the longer you smoke. People with high blood pressure, uncontrolled blood pressure for sure, but even controlled blood pressure over time can lead you to have a risk of stroke. Another one would be diabetes, particularly uncontrolled diabetes. And finally, one of the main other risk factors for stroke would be abnormal cholesterol or triglycerides, abnormal lipids. So those four, if you know about those, well, certainly cigarette smoking, you don't smoke. But for high blood pressure, diabetes, cholesterol, there are certain diets that your physician may give you to help control those. So secondarily, they may help prevent stroke. but there's no food that specifically causes or prevents a stroke.
Okay, very good. Thank you. We just received a question live, and it actually feeds into our next pre-submitted question, and that is, can strokes be genetic, or can someone have a predisposition for them?
That's a very interesting question, and that is actually kind of a complicated topic. Yes, strokes can be genetic. Most of the time, they're brought on by changes to the blood vessels because of the risk factors we talked about: smoking, high blood pressure, diabetes, cholesterol. They work on the blood vessels and make them easier to close off or have problems.
Mm-hmm.
But there are genetic conditions for stroke as early as childhood, and strokes can run in families because blood vessel problems, genetic blood vessel problems, people who have a tendency to have clots, that can be genetic.
Mm-hmm. Okay, great, thank you. A follow-up question to that: do you commonly see strokes in adult patients versus children? Do you ever see strokes in children, or how often do you see that?
Another good question. Strokes can occur at any age. Now, I'm an adult neurologist, so I primarily treat 18 years and older, and we see strokes mostly in adults from the 40s up through the 90s. But strokes can occur at any age. At Mount Nittany, our youngest stroke in the last few years was 3 years old, and our oldest was 102. So it's any age. The strokes in the children, particularly the very young children, they actually have different sets of risk factors and genetic conditions that are involved. And if we have a child or someone preschool or younger, and they come to the emergency room with stroke symptoms, they'll probably be triaged and then sent to a major medical center like Danville or Hershey.
Mm-hmm. Okay, very good, thank you. The next question, and our final question here today, is interesting. Is it possible to have a stroke and not even know it? How common is that, if so?
Yes, actually, it's more common than you think. There are terms that people use called mini strokes, teeny tiny little strokes. And the older you get, the more you can accumulate these little mini strokes, particularly, and I'm going to emphasize particularly, if you have these uncontrolled risk factors. If you're a smoker or have blood pressure or diabetes or cholesterol that's not really age and move through adulthood, you'll accumulate these little tiny spots and dots in your brain, and we call them mini strokes, very small vessels closing off. And the interesting thing is, most of the time, you won't have a symptom with those. They're so small, and the area of brain involved is so small that there really isn't any symptoms. So I guess the take-home message is you have to control your risk factors for stroke first and foremost.
Mm-hmm. And Dr. Roy, I apologize. Your audio cut out a little bit when you were talking about some of the factors that could lead to a mini stroke. I believe you mentioned cholesterol. Were there others that could lead to these mini strokes?
The factors for mini strokes are the same as the factors for regular strokes. Cigarette smoking, high blood pressure, diabetes, and cholesterol problems or related lipid problems.
Okay, got it that time. Thank you. Well, that's all the questions we have for you today, Dr. Roy. Is there anything that you'd like to share with us that we haven't already touched on, or anything you'd like to reinforce for our viewers today?
Well, I think what I'd like to do is reinforce a couple of things. Remember the acronym BFAST. And if you think you're having any sign of possible stroke, call 911. Not stroke, so be it. But don't miss a stroke, because we can help. The sooner we get you, the better we can treat you.
Okay.
Only other thing I want to emphasize would be know the risk factors for stroke, and please talk to your doctor about treating any kind of sugar, diabetes, high blood pressure, cholesterol issues, and please stop smoking.
Great. Know your risks, know the signs, and don't smoke. We got it. Thank you, Dr. Roy. Thank you so much for your time today. Thank you, everyone who tuned in. For more information about the services we featured today, please be sure to visit mountnittany.org, and please continue to follow our Facebook page for our next virtual tour stop. Thanks, everyone. Thank you, Dr. Roy.
Thank you. This was fun.